Sciatica is something very difficult to treat on your own. Other than stretching and maybe taking some anti-inflammatories, which if you've watched my other videos, I'm typically not a big fan of, but I'm also a realist and I know sciatica hurts and sometimes you do need that medication. But really for sciatica, you really need to have someone, a good osteopathic physician, take a look at you, help find out what's causing the pain, and then getting you into a treatment program that addresses your specific cause of the back pain. So what is sciatica? Sciatica is generally defined as pain that runs from the back, usually down the buttock, down the back of the leg. What I look for in patients is I oftentimes try to figure out where the pain is at in the leg and also how far down the leg the pain goes. Pain that's from a nerve root compression, be it back at the spinal cord in the center of your spine or where the nerves exit the spine or even somewhere in the hip, will oftentimes compress the nerve and cause pain that goes at least past the knee and sometimes all the way down into the foot. Commonly though, there's many things other than nerve compression that cause this sciatic pain. Other than just nerve root compression, we also have things that cause pain in the low back, such as malalignment of the vertebrae, pain in the muscles, trigger points, ligaments that hold our bones. So again, not all pain that goes down the leg is necessarily related to a nerve compression. These trigger points, malalignments in the spine, common culprits. If someone has sciatica, one of the first things that I want to do is to find out whether or not we have nerve root compression. Sometimes that can still be treated as an outpatient or be treated in an office, but sometimes that does need more aggressive treatment, such as spinal injections or potentially even surgery. But let's just assume for a moment that it isn't from a disc or it isn't from a nerve compression that needs to be treated surgically. So how do we approach that? I might look at doing some stretches, muscles called the piriformis, which is located in your buttock. Stretching that can be helpful. Also a muscle called the psoas can be very helpful as well. A lot of us don't get as much exercise as we should. We don't use our bodies as they were designed to. We have a sedentary job. In those cases, some therapeutic exercises, therapeutic stretching, sometimes yoga can be quite helpful. Also, another thing that can be quite effective is acupuncture. We know from modern research that the acupuncture needles change the blood flow. They increase your body's own natural painkillers, and they also release the muscle tension and the tissues in the fascia, or the connective tissues around the body. Another thing I frequently use in my office is osteopathic manipulation. That's a very gentle hands-on treatment technique. We don't do a lot of thrusting or twisting, cracking type of motions. If someone does have trigger points, sometimes that can be treated with osteopathic manipulation and acupuncture, but at other times it's more helpful to do trigger point injections. If we do have damage to the ligaments and that's causing the bones to move too much, then what we do is we do a treatment called Prolotherapy. The idea behind Prolotherapy, or platelet-rich plasma, PRP, is that we inject a substance into those ligaments to help them grow and come back stronger. Once those ligaments get stability, the bones don't move as much, the muscles start to relax, the muscle spasm goes away, the chronic pain goes away, the joint moves better, and prolotherapy can be an excellent treatment for sciatica. But really for sciatica, you really need to have someone, a good osteopathic physician, take a look at you, help find out what's causing the pain, and then getting you into a treatment program that addresses your specific cause of the back pain.